I'd like to welcome everyone to this year's Mayfaire celebration. I hope everyone has an enjoyable time and enjoys the festivities that we have planned, as well as the great food and camaraderie. This is the 10th anniversary of Mayfaire. This year's Mayfaire celebration focuses on our new Heart and Vascular Institute and the Patient Care Tower. We really do want to focus on patient-driven care, and we plan on trying to provide care really from the time they hit the door to the time they go home within that room, without having to have the patient move from room to room.
My experience with Benefis Healthcare and the heart cardiac unit began over 12 years ago when I woke up with chest pains in the morning and went to the hospital and ended up with 5 bypasses that day, another heart attack a week later, eventually a stent. And I'm very, very lucky, I'm very blessed in that people at Benefis gathered around me and provided me with a future program.
Medicine has come so far. Look at me, I should have been dead 3 or 4 times. But each time I was intervened by a physician who knew what they were doing. And I can't say enough about that.
I had a heart attack, and it was on Father's Day, and what led up to the heart attack was I was under a lot of stress. I had just moved to a new house we'd purchased. I was working 50 hours a week. Once I got to Benefis, I relaxed, I was comfortable, and they did the procedure, and the next thing I know, I woke up a little bit after lunch on Sunday morning and just continued to receive excellent care. The 12-week program that I went through Benefis, the peak, was excellent. When I had the heart attack, I weighed 242 pounds, and now I'm down to 190.
There was no history in my family as far as heart problems. So when I was told I needed 5 bypasses, I was just absolutely horrified, shocked, stunned, whatever you might want to call it, because I do a lot of walking, I eat the right kind of diet, and so here I am. How can that happen? 5 bypasses. It ended up that I was in the hospital for almost 2 weeks, and I had received the utmost care from the staff, the doctors that I could possibly have asked for. They were kind, helpful, and always there when I needed them. I just can't say enough. They were just absolutely wonderful.
My entire livelihood, my occupation, everything is very physical. It's 2 hours of cardio work 2-3 nights a week, and then working out in between. I remember after my workout in my house, 11 miles north of Shoto, when my heart attack symptoms started setting in, and I remember looking at the clock and it was 10 a.m. We rushed through the ER at Teton Medical Center, and with their collaboration with Benefis Health System, they were able to get me to Great Falls through the cath lab, directly through the cath lab, and I was finished with a stent procedure, lying in a hospital bed, feeling better at 12:30 in the afternoon. So the speed that those 2 groups worked with and the efficiency and the quality of care that I got was unbelievable, because during a heart attack, speed and quality care is what saves lives, and they did that for me. I returned to my job as an entertainer for the professional bull riders in the arena exactly 37 days after I had a heart attack. And that's not just standing on a stage doing stand-up comedy. It's pretty high velocity cardio stuff. Two things saved my life and got me back that fast, and that was being in very good physical condition and the efficiency and speed that I was treated. That saved me. A lot of people would have died from the heart attack I had. So I'm back at work. I'm touring the country again just because of the care I got.
That facility is very important to the improvement of cardiac care in our regional area. It is so important for the recruitment of medical doctors, of cardiac doctors, of heart surgeons, who want to be on the cutting edge of modern medicine. They're coming out of medical school with that knowledge. We have to provide them with a place to put it to work.